Hello friends, in this video we are going to see about the EEG, that is the electroencephalogram. So let us see how the leads of EEG are connected and how it works. So these are the EEG electrodes. We have connected these EEG electrodes to the patient, and this is connected to the PC. So here you can see the waveforms, electrical waveforms in the brain, and these activities we have to record for 30 minutes, and we have to take print. The printer is also connected here. So for this patient, we have just taken the print. So hello friends, let us see about the electroencephalogram, that is EEG. So basically EEG is a method to record the macroscopic electrical activity of the brain by placing electrodes on the scalp. And the uses are, it is a good diagnostic tool for epilepsy patients or seizures, and it is also used to monitor the sleep quality, and it is used in sleep disorders, and also for other neuronal disorders it is used. So basically in this EEG, signals are recorded by the machine. These leads are placed on the scalp, and the signals are recorded by the machine, which is later looked by the doctor. And it detects a population level of neuronal activity, and it does not detect a single neuronal activity. So let us see how the leads are placed on the scalp in this EEG. So let us see the placements of electrodes on the scalp. So basically these electrodes are classified into left and right side. So on the right side, as we can see here, even number electrodes are placed. For example, 2, 4 are on the right side, whereas the odd numbers such as 1, 3 are on the left side. And there are frontal, these electrodes are placed on frontal, parietal, occipital and temporal regions of the scalp. On frontal there are total 23 electrodes, and out of that frontal are 7, parietal are 3, occipital are 2 and temporal are 4. So these frontal electrodes, you can see these FP1, FP2, then F3 and F7, as we have discussed. On left side odd numbers are there, whereas the even numbers such as F4, F8 are on the right side. And then parietal P3, P4 and PZ. So you can see parietal region, these are the P3, PZ and P4 on the parietal region. Then on the occipital region, O1 and O2 are the 2 electrodes on the occipital region, and temporal are 4 electrodes, T3, T4, T5 and T6. So this is T3 and T5 on the left side, and T4 and T6 on the right side. Then there are central electrodes, that is 3 in number, C3, C4 and CZ. So you can see here on the center, this is C3 on the left side, C4 on the right side and CZ in the center. Then there are some temporal preauricular electrodes also, that is the T3 and T4 are the preauricular or also known as the preauricular electrodes. Then behind the ear, T5 and T6. So as we have discussed, T5 and T6 are behind the ears. And there are 2 special electrodes are there. This is the G and R, that is G stands for ground electrode and R for the reference. So this ground you can see between the eyebrows, this we have to place between the eyebrows, and just 2 fingers above that we have to place this R, that is the reference electrode. So these are 2 special electrodes, ground electrode and reference electrodes. And 2 more electrodes are there, that is the auricular electrodes, that is you can see here on the ear, these are placed A1 and A2, these are the 2 auricular electrodes. So these are the total 23 in number electrodes, and this is the placement of electrodes, how it is placed.